The AML17 trial is a trial that has been completed largely in the UK, but it's a multinational study also involving Denmark, New Zealand, and it's looking at patients under the age of 60 with acute myeloid leukemia. Having completed recruitment, we're now in the phase of being able to go back and look at the data and be able to analyse the outcomes. What's particularly relevant for this meeting is that we've been evaluating the response for one of the randomisations with regards to escalated doses of daunorubicin, which has been topical for quite some time. For this randomisation, there was approximately 1,300 patients involved in the randomisation, and it was really trying to address the question about what the optimal dose of daunorubicin to utilise in induction chemotherapy was in acute myeloid leukemia. There have been 3 previous randomised studies which had suggested high doses of 90 milligrams would be optimal, which was quite different from the UK approach. And so this study was the larger than any of the other studies, being able to evaluate the question, and informed us that dose escalation beyond 60 milligrams was not beneficial in general. There's increased toxicity, particularly when measured at 60 days, and concerns about cumulative anthracycline dose having long-term cardiotoxic effects. Essentially, both groups of patients did extremely well. There's now updated data which Professor Russell presented this morning, and this is specifically looking at a subgroup of patients who had FLT3 mutations. Now, FLT3 mutations being very topical internationally. There's a large Novartis-sponsored study, the RATIFY study, which was presented at ASH last year, which showed that the utilisation of the drug midostaurin improved survival for patients who are FLT3 mutated. Clearly, this is an intervention that we didn't have within our UK-based studies, so we've gone back to evaluate the trial and see, if our outcomes were comparable. What we've then been able to show is that by escalating the dose of daunorubicin at induction, that this actually does improve the outcome for the patients in the subgroup who have the FLT3 mutation, and that the outcome there is certainly comparable with the RATIFY study. It occurs in approximately 20% of the patients within the study. Internationally, people have an increasing understanding and awareness that these patients don't do well with conventional approaches of chemotherapy, and historically people have been moving towards allogeneic transplant as a mode of dealing with the high level of relapse that these patients experience. Here we've seen in the RATIFY study evidence that using targeted treatment can improve the outcome for patients with or without transplant, and therefore there's a pressing need within other groups to evaluate other approaches. And here we've shown that by increasing the dose of daunorubicin, that there's an improved outcome, predominantly due to a reduction in relapse for that group of patients. The current study, which looks at the same population of patients, the younger AML patients, AML17, is ongoing, and our awareness of these results wasn't fully evaluated at the time the trial opened, but clearly within this subgroup we are looking at new agents and new approaches to improve the prognosis for this group of patients. The BSH meeting is a good meeting, but it's one where there are not necessarily new breaking information or new data in relation to studies that are reporting. So I think the highlights have predominantly been a consolidation of data that's already well known to the community, and really taking that data and trying to interpret in a fashion that can be translated into clinical practice within the UK. Certainly there's been some interesting approaches from diagnostic laboratories. We've highlighted the role of mutational screening in the myeloid disease field, particularly myelodysplasia, and really taking the US published data and evaluating how in a less selected group of patients, how the findings can be quite significantly different. And these clearly are far more relevant in the clinical practice within the NHS within the UK. Our main area of interest is trying to evaluate targeted approaches within acute myeloid leukemia. My particular interest is leading therapy for elderly patients who are not fit for intensive approaches of treatment. Been quite a lot of interest in this in terms of the standard therapy historically has always been low-dose cytarabine. There's now international data which has addressed the issue as to whether azacitidine might be a superior approach, and certainly within the US and in many European countries this is a considered improvement in the standard. But there are limitations to the data that's available there, and I think here at the meeting there's been an opportunity to have some in-depth discussions to evaluate some of those limitations and think about how future studies can be constructed to optimally address the ideal therapy for such patients.